what we will present is new findings that we obtained. We look at the mechanism of lymphocyte entry into tumor, and this is a very important step because if the lymphocyte do not enter into tumor, they cannot encounter the tumor cells and they cannot destroy the tumor. So it's critical, but it is poorly characterized. And we ask whether there are specialized tumor blood vessels that may mediate the entry of the lymphocyte circulating in the blood into the tumor. And the answer is yes. We discover specialized tumor blood vessels that we call tumor-associated high endothelial venule, tumor-associated HEVs. And these are really professional blood vessels for lymphocyte entry into tumor. Therefore, we show this using mouse preclinical models during treatment with cancer immunotherapy, with antibodies against immune checkpoint molecule, PD-1 and CTLA-4. So we combine anti-CTLA-4 and anti-PD-1 antibodies, different mouse preclinical models for breast cancer, colon cancer, sarcoma tumor, similar results in all the solid tumor models. And we found that these specialized tumor blood vessels that we can identify mediate the entry of lymphocyte into tumor, as they are almost the exclusive sites in the tumor blood vessels. And we visualized, we were able to do some imaging studies where we could visualize the entry of lymphocytes from the blood into the tumor for these vessels. And we realized actually almost all the trafficking, all the entry was occurring in the tumor-associated HEVs. And this was during cancer immunotherapy. But before treatment, at baseline, these vessels were already functional. Therefore, we believe they mediate the entry of lymphocyte into the tumor even before the start of the treatment. And during the treatment, they are very important for increased recruitment of lymphocyte that is induced by cancer immunotherapy with CTLA-4 and PD-1. CTLA-4 was very important for recruitment of lymphocyte from the periphery. So these are our studies in mouse preclinical models. And we also made some studies in human patients to look at the clinical relevance of our findings. And in collaboration with Professor Caroline Robert at Gustave Roussy Institute in Paris, we studied about 100 metastatic melanoma patients that were treated with cancer immunotherapy, either PD-1 antibody alone, nivolumab or pembrolizumab, or combined with anti-CTLA-4 antibody ipilimumab. And what we found in the total cohort, the tumor-associated HEVs were present in metastatic lesion, different numbers depending on the patient. And when we found high number of these vessels, this was associated with good response to the treatment and also increased survival, overall survival, metastasis-free survival. When we analyze separately the patient that received PD-1 antibody alone, or the combination PD-1 and CTLA-4, we found that the vessels, the tumor-associated HEVs, were highly predictive for the survival and the response of the patient that received the combined treatment, and they were not really predictive for patients that received only PD-1 antibody. We don't know why. We believe it's because PD-1 acts mainly at the tumor site, and CTLA-4 acts in the periphery and recruits more lymphocytes. That's been described by Nobel Prize winner James Allison. So we believe this is the mechanism at play, but we cannot be sure at this point. But really, these are critical for the response to the combination CTLA-4 and PD-1 antibody. And this is actually the best combination in the clinic. Highly toxic, that's the problem, but it's the best treatment currently available for metastatic melanoma patients.